Namaskar world! Welcome to our channel. Today we're going to talk about a serious health concern that affects millions around the world: dengue fever. Dengue is a mosquito-borne viral infection found in tropical and subtropical regions. Don't worry, we'll break it down into simple terms so you can understand this important topic. Dengue has been around for centuries, with the first recorded epidemic in 1779. Since then, it has spread rapidly, becoming a major public health concern, especially in urban and semi-urban areas. The World Health Organization estimates that around 400 million people are infected with dengue each year. The disease is now endemic in more than 100 countries in the WHO regions of Africa, the Americas, the Eastern Mediterranean, Southeast Asia, and the Western Pacific. The Americas, Southeast Asia, and Western Pacific regions are the most seriously affected, with Asia representing around 70% of the global disease burden. Dengue is spreading to new areas in Europe, the Eastern Mediterranean, and South America. The largest number of dengue cases reported was in 2023. The WHO region of the Americas reported 4.5 million cases, with 2,300 deaths. A high number of cases were reported in Asian countries like Bangladesh, Malaysia, Thailand, and Vietnam. The good news is that with the right knowledge and precautions, we can protect ourselves and our loved ones from this disease. So, let's dive in and learn more about dengue fever. Dengue fever is caused by a virus, cleverly named the dengue virus. This tiny troublemaker belongs to the flavivirus family, which is also responsible for other diseases like Zika and yellow fever. There are 4 different types of dengue virus, known as serotypes: Dengue1, Dengue2, Dengue3, and Dengue4. You can get infected with any of these serotypes. After recovering from an infection with one serotype, you develop lifelong immunity to that specific type. However, you can still be infected by the other 3 serotypes. The tricky thing is, a subsequent infection with a different serotype can sometimes lead to more severe forms of dengue, like dengue hemorrhagic fever. So, even if you've had dengue before, it's crucial to continue taking preventive measures. Now, how does this dengue virus spread? It's all thanks to a tiny but mighty creature, the Aedes mosquito, primarily Aedes aegypti. However, in 2023, a surge in local transmission of dengue by Aedes albopictus, aka tiger mosquito, has been seen in Europe. Aedes aegypti is easily recognizable by its black and white stripes. The female Aedes mosquito bites an infected person, picks up the dengue virus, and then transmits it to other people through subsequent bites. These mosquitoes typically breed in stagnant water found in containers, tires, and even flower pots around our homes. That's why it's so important to eliminate breeding sites and protect ourselves from mosquito bites, especially during the daytime when these pesky insects are most active. Now let's talk about the symptoms of dengue fever. It usually takes about 4 to 10 days after being bitten by an infected mosquito for symptoms to appear. Dengue often starts with a sudden high fever, usually 104 degrees Fahrenheit or 40 degrees Celsius, accompanied by a severe headache, pain behind the eyes, muscle and joint pain, and a rash. Some people also experience nausea, vomiting, or loss of appetite. These symptoms can be quite debilitating and often mimic other viral infections, making it tricky to diagnose dengue based on symptoms alone. If you experience any of these symptoms, especially after traveling to or living in an area where dengue is common, it's crucial to see a doctor immediately. Early diagnosis and proper medical care are essential for a speedy recovery. Diagnosis is based on the patient's symptoms and epidemiological factors, particularly if they have recently traveled to a dengue endemic area. Additionally, it includes antigen tests like NS1 for early detection, RT-PCR for viral RNA, and serological tests for IgM and IgG antibodies. The timing of the test depends on the phase of the illness. Dengue infection has 3 clinical phases. First phase is the febrile phase, which begins with a high fever, often accompanied by other symptoms such as facial flushing and rash. This phase lasts 2 to 7 days. Second phase is the critical phase, which occurs 3 to 7 days after the onset of fever. As the fever subsides, warning signs of severe dengue may appear, such as severe abdominal pain, persistent vomiting, fluid accumulation, mucosal bleeding, and lethargy. Utmost medical care is needed if any of these warning signs appear. Finally, third phase is the recovery phase. If the patient survives the critical phase, a gradual reabsorption of extravascular fluids occurs, and clinical improvement is seen. Unfortunately, there is no specific antiviral treatment for dengue fever. However, with proper medical care, most people recover fully within a couple of weeks. Treatment mainly focuses on relieving the symptoms and supporting the body's natural healing process. Doctors usually recommend getting plenty of rest, drinking plenty of fluids to stay hydrated, and taking paracetamol to reduce fever and pain. In severe cases, hospitalization may be necessary for intravenous fluids and close monitoring. It's important to avoid aspirin or ibuprofen, as these medications can increase the risk of bleeding complications in dengue patients. Remember, early medical attention and proper management are key to a smooth recovery. Prevention is always better than cure, and this holds true for dengue fever as well. The most effective way to prevent dengue is to avoid mosquito bites and eliminate mosquito breeding sites. Wear long-sleeved clothing and use mosquito repellents containing DEET or picaridin, especially when outdoors. Make sure to remove any stagnant water around your home regularly. Cover water storage containers properly and change the water in flower vases frequently. These simple steps can significantly reduce the mosquito population around your home. The primary vaccine available for dengue is Dengvaxia. It is effective against all 4 serotypes of the dengue virus. Depending on the country-specific regulations, it's approved for individuals aged 9 to 45 or 9 to 60 who have had prior dengue infection, confirmed by laboratory testing. It is not recommended for those who have never been infected, as it can increase the risk of severe dengue. It's administered in 3 doses at 6-month intervals and provides about 60% to 80% protection against symptomatic dengue in individuals with previous dengue exposure. Its efficacy varies across different serotypes, and it has been shown to be more effective in preventing severe dengue than mild cases. Another vaccine, QDenga, has been approved and licensed in some countries. However, it is recommended only for the age group of 6 to 16 years in high transmission settings. Additional vaccines are in development, with some in late-stage clinical trials, offering hope for broader protection in the future. If you live in or are traveling to a dengue endemic area, talk to your doctor about whether vaccination is right for you. Remember, by taking these preventive measures, you can protect yourself, your family, and your community from this potentially dangerous disease. Stay safe, stay informed. This video is brought to you by Dr. Rajdeep Bahadur Khatri. If you found this video helpful, then don't forget to like, share, and subscribe to our channel for more content like this. See you next time.